Well, great. It's nice to meet you. I've met some of you in person. Some of you I've met at other recruitment fairs. I've talked to over email, and some of you are new to me. So I'm Ellen Carlin. I'm the director of the Master's program in Global Infectious Disease. And I'm really delighted that you could join us today. We're excited to, share news about this new and growing program. And we're really looking forward to adding new and talented students into the program every year. So in hosting these webinars, it just gives us a chance to get a little group FaceTime with everyone and share kind of the broad strokes about the program. And then I am always available for follow-up one-on-ones. The program is, in some respects customizable. In some ways it's rigid, there's a lot of core requirements, but in some ways it's customizable, and some people have questions about their particular circumstances. Do they go part-time? Are they a Georgetown student and they already took a lot of the prereqs? So I will make myself available at any point to answer your questions. But in the meantime, I think I'm just going to put up a few slides. We probably, this is like 20 minutes worth of slides. We probably won't need the full hour, but I've reserved a lot of time at the end, either for Q&As or to go to breakout rooms with folks, or just to give you back a little time in your busy day. So with that, let me share these slides. Okay, thumbs up. Everybody can see these? Great. And this is really informal. Please feel free to either raise your hand, your virtual hand or your real hand, or just pipe in. If I can't see you raising your hand, just interrupt me and ask a question. That's totally fine. So we're talking today about our MS in global infectious disease. We also have a PhD. If you're here because you think this is about the PhD, this is not the right webinar, but I would be more than happy to talk with you about the PhD at a later date, or to put you in touch with other faculty who can speak with you about the PhD program. We will briefly just give a little bit of an introduction to Georgetown and to GLID. We'll talk through what some of the course requirements are. We'll talk through admissions requirements and then open it up for any more questions. My one request is, since I'm here on my own, it's difficult for me to monitor the chat. So just save your questions and just ask them verbally when you're ready, if you don't mind. Or if you don't want to ask in front of a large group, you can ask them privately later. So I should really turn this over to Kayla. She's been at Georgetown longer than I have. I started at Georgetown in February of 2020, that magic month right before shutdown. And so we've only really just opened back up. And I've been getting to experience the splendor of the Georgetown University campus. And it really is as beautiful as it looks in these photos. For those of you who have never been, Georgetown is situated in the heart of the nation's capital, right along the Potomac River. And it's a really exciting place to study. I grew up in and studied in New York City, but I always knew that I wanted to come to Washington, D.C. to work. I sort of wanted to be at the heart of where all of the big science and political decisions were getting made. And if you come to Georgetown for graduate study, that gives you the opportunity to do that here. We have a vibrant community on campus of professors who work for the federal government. We host seminars regularly where we bring in government officials and private sector officials and philanthropists to come and talk to our student body. And then, of course, we also encourage students to think about internships, summer opportunities, working in Washington, and then many will choose to stay on in Washington after they graduate, where we believe there will be plenty of job opportunities for you. Georgetown was established in 1789. It's not the oldest American university, but it's among the oldest. It's also got one of the largest populations of graduate students of any school in the United States. And so it's really a thriving graduate school community. Brief introductions to who we are. So the executive committee for GLID is made up of myself, Dr. Rebecca Katz, who's with the Center for Global Health, Science, and Security, Dr. Shweta Bansal, who's a modeler with the Department of Biology, and Dr. Steven Singer, who is a parasitologist and immunologist with the Department of Biology. I should have mentioned Dr. Katz specializes in governance and global policy. And I am a veterinarian, but I've always been really interested in the epidemiology and policy side of medicine, of understanding that, that interface between animals and people and their environment, and how does that work? What are the dynamics and what does it mean for the real world? So there's a nice spread. If you look at our full faculty affiliation page, you'll see dozens of faculty who all have appointments elsewhere at the university, but who come together as affiliates of the Global Infectious Disease program. This is really central to our interdisciplinary nature, right? Like this isn't a master's degree within the biology department where you're going to get, a master's in biology or a master's in microbiology, for example. There's absolutely nothing wrong with that if that's what you want to do. But if your interest is in sort of working at those interfaces between problems, or just being the kind of person who says, well, sure, I want to be an epidemiologist, but I also really want to understand what the politicians are doing and what they're thinking, or what the modelers are doing and thinking. This is a good place for you because we have faculty from all over the university. And that faculty page is not complete. It's dynamic. We're always adding to it. And we also bring in a lot of adjunct professors. For example, in the spring, we're teaching a class in global health policy analysis, and it'll be taught by a current senior aide to a senior senator on Capitol Hill, who'll be coming on Wednesday evenings to teach this class. So it's a really exciting time to be part of the program and in Washington, D.C. Oops, sorry. Okay, any questions so far? I know I talk fast. I'm from New York, if I didn't mention that. So the GLID Vision, right? The establishment of the GLID Vision preceded me. This program was in the works for a couple of years before I arrived, and I arrived just in time to launch the program. So I definitely feel a sense of ownership of it now. It's kind of become my baby. I'm proud of it, and I'm always working to improve it. But it was really viewed as necessary by people who were already here at Georgetown and who saw a need for a program that could help educate students at these really complex nodes of this really complex problem. They knew what would happen in a COVID situation, right? And that was really sort of the genesis for a program like this. COVID happens and suddenly it becomes really clear that, fighting infectious disease isn't just about one thing. It's not just about pharmaceutical development for vaccines or diagnostics. It's about economics, it's about decades worth of public health infrastructure. It's about people, sociology, politics, just this incredible kind of convergence of fields. And, they wanted to foster an environment where someone who wanted to make infectious disease their life's work could come in and get a working foundation in what those issues are, and what the kind of tools are that could be applied to resolve them. One of the really nice things, as I mentioned, we have a Ph.D. program. So our master's students and Ph.D. students, most of whom already have masters, actually take classes together. They take a lot of classes together. And we have journal clubs together and lots of other fora for mingling. And so it's a great way to bring students up kind of to the next level. There's a big jump between undergraduate and graduate education. We have some students who are Georgetown undergrads who are starting to take our grad classes. They're working their way into enrolling into our program. And, they can really see that there's like a big jump in the level of expectation. And it's a different kind of expectation in graduate school. Undergrad is often about sort of just learning like mountains of information. And in this program, there is that, but we want you applying that information really critically the way you're going to be expected to when you get out into the working world. So what do we think that working world looks like? Well, we're just in our second year now. So our first cohort that started a year ago is going to graduate at the end of December. So students ask me all the time, like, where do your graduates go to work? What are your graduation rates? Is your program diverse? What are your statistics regarding demography and race? I'm like, I just don't have a lot of data points yet. But it's kind of an exciting place to be because we can build this any way we want it, right? And what we want is for our students to be able to get out prepared. If they want their master's degree to be their terminal degree, this can be it, right? They can get out and get great jobs working in federal, state, or local government. Maybe they want to be a research assistant at an academic university. Maybe they want to work at various research institutes or think tanks. Maybe they want to go work for a pharmaceutical company in their policy shop, their federal affairs shop. Maybe they want to work for, myriad nonprofit organizations and other NGOs out there. Maybe they want to work on the domestic side, but maybe it's global. They want to say, I want to be part of WHO reform, be part of the next generation of what WHO is going to look like. So we think that all of those doors will be open. I should add that a lot of students are using masters these days as a bridge to further graduate study. So our graduates this year are applying to medical school, veterinary school. I expect some will go on to do PhDs. Some may go on to do a second master's, double master's, or is not unusual these days. There's a variety of ways you can think about this degree, but you should all be thinking really critically. It's not a small investment of time or money to get a master's degree. And you should be asking yourself, like look at it two ways. What is it that I'm going to get out of this degree, that situates me better to go into the working world, but then also kind of put your employer glasses on. Like, what are employers looking for that this program will give you, that will allow you to present yourself to these employers. And a lot of times with employers, we can talk a little bit more about this, but do I get an MS or an MPH or an MPA? Some employers will care a lot. Many employers won't care at all, right? They would just want to see that you have a master's degree from a creditable university. So there's different ways to think about this, but make sure you're thinking about it, right? Because it's your time and your money. The GLID program is a full-time program. I should caveat that by saying that we actually do have part-time students. We don't advertise it officially as part-time, but the reality is that we work with every student to come up with a program that suits their needs and their life circumstances. The 30 credits, as we have formally mapped them out, work out over 3 semesters, a fall start, and then a spring semester, you get the summer off, and then you finish up the following fall. That's very doable. It's like a 12 credit semester, a 9 credit semester, and another 9 credit semester. So it's like, works out, what is that, 17 months, August to December, something like that. Some students want to take their time either because they want to work part-time. I actually have a student who's working full-time, and she's making this work, taking 2 to 3 credits or 2 to 3 classes per semester. We do offer evening courses, but there are a number of courses that are only offered during the day. And so if you're looking for part-time study because you want to work full-time, you may need to work that out with your employer and say there's going to be a couple days a week where I have classes in the middle of the day. Some employers will be okay with that, and others won't. But we're happy to allow you to kind of stretch out the time as long as you complete the degree within 3 years. So I have some students that'll do it in 4 or 5 semesters instead of 3. Something that that's part of our degree program is a capstone research requirement. So this will happen in your last semester. It's a 2-credit requirement, and this can take the form either of a literature review, where you're going to synthesize you get to pick the topic, but it needs to be interdisciplinary in keeping with the degree. And some students will do a good enough job on this paper that this could actually be publishable in a journal, which is really exciting. Other students will want to do original research, not lit review research. So I have a student right now who's working with Dr. Bonsall, the modeler I showed you before, and she's analyzing data on influenza and COVID vaccine rates and looking to sort of compare and contrast who's getting vaccinated and where and for which infectious disease. That type of thing could be publishable. And the requirement for that is that you present it to us as in the format of the kind of paper you would submit to a journal. This gets at something that's unique about or different about GLID compared to, say, an MPH program. There's definitely a research angle here. It's a master's of science, right? And so you're going to be exposed to a lot of research, a lot of literature. We want you to really understand how to read literature, how to think about it, summarize it, analyze it, and use it to create good evidence-based policy. This isn't a practitioner's degree the way an MPH is. We're not expecting you to come out, with all of the research credentials that a PhD student would, but we will expect that by the time you graduate, you will have improved your ability to do research in one of our 2 concentration areas, which I'll talk about in a second. And that whatever job you go into, you're going to have improved research skills to support that job. So we think this is exciting, right? Because I think anyone who's on this call is intellectually curious about the world, and that's what research really helps you do, find out more about how the world works. This is the way the courses break down. So up here where it says joint courses, 18 credits, these are the classes that everybody takes. All of the master's students take these. This top one, Interdisciplinary Perspectives in Infectious Disease, this is kind of our flagship year-long class. It's broken up into 6 modules. Each module is a credit. And over the course of this year, you'll get modules on, it's usually a disease. So we started with HIV in September. Right now, Dr. Singer is doing an entire module on neglected tropical diseases as kind of a whole category. I will be doing a module in November on antimicrobial resistance with a focus on antibiotic resistance and how human and animal use of antibiotics creates this risk, this problem. We've had modules on COVID. We're offering one on filoviruses like Ebola. And so it's an opportunity, and each module is integrated, right? Like you're going to get basic science, you're going to get epidemiology, you're going to get modeling, and you're going to get policies. So it all weaves together. And the idea is that we're getting you to think critically about not just individual infectious diseases, but like how the domestic and global community sees them and handles them in the real world, and what works and what doesn't. Infection and Immunity is a 3-credit basic science course. It's basically microbiology and immunology. You'll take epidemiology, biostatistics, a 1-credit research ethics course, and then your 2-credit capstone. Now, the tables below represent our concentrations, which I'll talk about in a little more detail on the next slide as well. But when you apply to GLID, you have to choose a concentration. And it's an important choice because you have to have certain prerequisites in order to qualify. So if you're applying for data modeling courses, but you have like 0 experience in computer science and very little math background, it's either not the right concentration for you, or it's not the right concentration yet. Like maybe you want to wait a year and apply. We do we do offer leeway so that if you're lacking in some of the prereqs, you can actually apply and then commit to taking those over the course of, whatever time is left between now and when you start the program. But basically, if you look at the names of these data modeling courses, these are math and computer science courses. Each concentration has 4 classes. So you're not going to become the world's expert in mathematical modeling of an infectious disease, but you're going to come out really articulate about it. You're going to be able to read papers about modeling, and it's not going to be complete gibberish like, it might be right now. And you're going to understand, what do those models mean? What are the limitations of them? What kind of parameters go into making a model? You're going to get some practice making models, using data sets to create models. So that's kind of exciting because if anyone's been paying attention during COVID, you've seen how important models have been, especially early on, and how controversial they've been. Are they right? Are they wrong? What kind of decisions should we make with this information that may or may not, be actually correct and predictive? On the policy side, so there are 3 required classes and then an elective: policy analysis, global health security and diplomacy, health economics and financing, and then kind of the world's your oyster when it comes to electives. It just has to be approved by me, and it should have some nexus to infectious disease, economics, or policy. Any questions so far? Claire.
Quick question on the data modeling courses. What kinds of math classes are you wanting? Like, is there a specific amount, like calculus that you should get to, or stats class that you should have taken?
Yeah, sure. Hold your question for 2 slides because I'm going to have a slide on prereqs. But great question. This is just a little bit more information about the concentrations. I don't want to overwhelm you with all this text. I'm certainly not going to read it to you. You can find more about the concentrations on our website. There's these little drop downs where you can click and it opens up descriptions of what these concentrations are really designed to do. So the way we think about the concentrations is it's kind of like a minor. So many of you who are undergrads, you have your major and you might have a minor. Think about the concentrations that way. It's like, I want to come to GLID because I want to get much smarter about basic and applied science as it relates to infectious disease, immunity, microbiology, epidemiology. But then I just want a little bit extra because I think that I want to go work on Capitol Hill, and be an infectious disease advisor. Well, then policy might be the right place for you, NIH has a policy shop. CDC has a policy shop. WHO is all about developing guidelines and governance, right? So policy could be a great option for someone thinking along those lines. And then on the data modeling side, if you want to be a data modeler extraordinaire, you should go get a data modeling degree, right? As far as I know, GLID is the only master's program that offers, an infectious disease master's degree with this niche of data modeling as a concentration option. So like other programs, like we have a great data analytics program at Georgetown University, data science and analytics. It's another one of our interdisciplinary programs. If you love computer science and math, that could be really good for you, but you're not going to get so much of the infectious disease piece. So you should just at this stage be really thinking about what it is that you want to get out of your degree. Student life at Georgetown. I mean, I would have loved to have been an undergraduate here. There's a lot going on, and there's a lot going on at the graduate level. We have a very active graduate student government. They've instituted a lot of change over the last several years, more spaces for graduate students to gather exclusive from undergraduates, a collective bargaining agreement that governs how many hours students can work in like a research assistant or just a campus job capacity and how much they make. There's just a ton of clubs and organizations. Certainly during the pandemic, there just wasn't a lot of that happening, but it's all ramping up again. Tons of seminars, like I said, and a lot of really cool resources. At the graduate school, we have a career center where you can get career coaching. So, from everything from like how to write your resume and your CV to like mock interviews to just like thinking about a strategy for searching for a job as you get closer to graduation. And we also have a wonderful writing center that does a really great job in helping students who want to improve their writing. If you're not good at writing, it can help get you there. And if you're good at writing, it can make you great at writing. So these are just some examples of the things that grad students should be taking advantage of. Financial support. How much does the degree cost? So tuition at the graduate school is a per credit basis, and it changes each year or most years. Right now, it's about $2,200 and change per credit, and this is a 30 credit degree. Almost every student that gets accepted into GLID will receive a partial merit scholarship. We do that because we know it's an expensive degree and we know that you have choices. So we're hoping that, the sort of financial cost of attending grad school doesn't keep you from Georgetown. We have a really great financial aid office that works with students to develop additional options beyond the merit aid, such as graduate student loans, government loans, private loans. I also am always happy to put students up for private scholarships. There's a variety of external scholarships. There's lots of like policy scholarships, but there's none sort of dedicated to this area. But anytime I see something that's like remotely qualified, I either propose my student for it, or they might ask me to write a letter for them if they want to apply for something. In any case, we're very supportive. And finally, the schedule is often, it's sort of situated in such a way that many students will have time for on-campus jobs or other jobs. I want to encourage students to think of the program, if you're going full time, really think of it as your primary priority. But like the first semester, for example, tends to be very heavy on Tuesdays and Thursdays with a lot of time free on Monday, Wednesday, Friday. So if you can feel like you can balance your school workload with a job, that's another way that students help support themselves financially. Okay, we're getting close to the end here. So application requirements, you can find out a ton more on the graduate admissions webpage about what you need. But the basics are you're going to have to submit any transcripts you have from any academic institution. For most of you, that'll be your undergraduate transcript to date. If you have a graduate degree, or you've, say, done study abroad, or you did a summer class somewhere, you'll need to submit those too. What we want to see in our applicants is a background in biology, and then also calculus or statistics. You guys might be lucky because we might be changing this soon to be calculus and statistics, but for right now it's one or the other. And if you've taken some random math class that's neither one of these, you should still at least apply because our admissions committee has a little bit of leeway to look at your transcript and say, like, yeah, we think that this meets the spirit of the prereq and the reason for it. Because you're going to be taking more advanced statistics classes. There's a lot of math and epidemiology, and we just want to make sure that you're comfortable enough with numbers to succeed in those classes. Students applying into the data modeling concentration are going to need more math. They're going to need, an additional semester class of, either a hardcore math class or an advanced statistics class. And it's really helpful to see some computer science or computer programming on the transcript. On the other hand, the policy students, we want to see background in economics and political science. You know, it's easy to say, oh, there's so much going on in the world of, you know, global health governance right now. I want to do policy. But if you've never taken a policy or political science or economics class, you might not know what you're getting into. So this is why we have these prerequisites. If you have not taken these classes or some of these classes or all of these classes, you can still apply to the program, and the admissions committee may still decide to admit you, but it's with the commitment that you will have completed these prereqs by the time you started. Technically, you know, you could take them or one of them in your first semester. I really don't recommend that. I think you really want to get your prereqs done in advance so that when you come here, you can focus on what you need to focus on. And you need, you know, good passing grades in all of these. There's no, you know, students ask, what's the GPA that's required? There's no specifically required GPA. It would be very rare that we would admit a student who had less than a 3.0, but it happens. And if, you know, some people have had extenuating circumstances in their lives and they explain this in their statement, there's a statement of purpose that you need to write. And then there's a second optional statement. And sometimes students use that optional statement to explain maybe, you know, a bad grade or grades, or, you know, they want to use it to explain how their racial or ethnic or religious background might help them. Like it's just an opportunity to tell us more about you and why you think that who you are as a person and what your experiences have been will help you be a great GLID student. 3 letters of recommendation. These are really important, really important. The admissions committee likes to see strong letters. You know, ideally from people who legitimately know you well. I do recommend that if you can swing it, that one of the letters should be someone from kind of high up in the food chain. You know, not if it means asking a complete stranger for a letter, but like ideally this would be someone who is the chair of your department, maybe your major department or possibly your minor department. Maybe this is like a senior PI of a lab that you worked in. Maybe you did an internship at the World Bank as an undergrad and you can swing a letter of recommendation from a director there, something like that. I don't want to see 3 letters from like all from junior faculty at your college. That's not diverse enough. And we need to see at least one person who's higher up. If English is not your first language, the TOEFL language proficiency is required. Completed online application, the fee is waived if you submit by January 15th. And no, we do not require the GRE. We're not interested in looking at your GRE scores either, so don't submit them. If you feel like, you know, your grades in math and in your coursework was bad, but you nailed the GRE math section, you can put them in your packet and explain in your optional statement why you're including them and make the case that the admissions committee should look at them because maybe they're a better reflection of your math abilities, for example. Let's see. Yeah, so please apply by January 15th. You know, I really encourage this because it does, you know, the fee is waived. It just also allows us to get all the applications in, make our decisions, make our merit aid decisions, and then sort of not worry that other applications will trickle in later. We will absolutely look at your application if you apply by April 1st. Over the last year or two, we've had students apply, you know, they email me in May or June or July, is it too late? And it does start to get too late to get everything together once we get past April 1st. But if you can't get it all together by January 15th, don't worry about it. You will be considered just as well as you would if you applied earlier. The only thing I can say is that you have a better chance of getting more merit aid if you apply earlier, because there's usually 1 or 2 students that really rise to the top, and we give them like our best merit aid package. And so it's hard to be considered in that if your application comes in the later pool. For those of you who are Georgetown juniors, you are eligible to join our accelerated degree program, which is basically a joint degree program. You apply in your junior year, and then in your junior spring and throughout your senior year undergrad, you take classes with us, and then those classes apply to your transcript. And this is a big time saver for Georgetown undergrads, and it also helps save you money because there are fewer classes that you have to take at the grad school tuition rate. I don't have a lot of slides prepared especially for the accelerated program, but you know who you are, and you should all be making appointments to see me so we can talk about that in more detail. Oops. If you have any questions, we'll take those now, but you can always email this email address. I monitor this inbox. You can also email me directly, ellen.carlin@georgetown.edu. With that, I'm going to stop sharing my screen and take questions. That was a lot of talking. Okay. Was it all very clear? Nobody has questions?
I have a quick question,
Sure.
which should apply to everyone. So you mentioned that a lot of the coursework focuses on applying information that'll be useful in the real world. I was just wondering if you could share a little bit more about what that actually looks like, what the application looks like within the GLID courses.
Sure. So the flagship course that I mentioned, Interdisciplinary Perspectives, would be a great example of that. It's 6 credits taken across a year. And, we talk a lot about the kinds of real world decisions that have been made. So this module that we just finished on HIV is taught by a woman who spent 10 years at USAID. And before that, she lived in Africa for decades. So she's imparting kind of knowledge and tools about how HIV/AIDS was handled in the real world in terms of public health decisions, in terms of development decisions by USAID and other governments. And so learning by example what worked and what didn't in terms of how these programs got implemented, how political decisions got made. With HIV, for example, there was a lot of politics that went into it. If you want to go into politics, you sort of need to understand what the sort of dynamics are for infectious disease. Some infectious diseases just take on a life of their own politically, and it's easy to get attention for them and get funding for them. I mean, it's really interesting if you look at like the early stages of when HIV was first emerging, and there were decisions made on the part of the CDC, for example, to not talk about this so much as like a gay men's health crisis, but just as a health crisis for the nation, right? Because they knew that would be the better way to garner political and funding support, just as an example. So the policy analysis class, that's a separate class, 3 credits. You will go through kind of exercises where you break down policies into this rubric of like, what is the policy? What is it trying to accomplish? How is it trying to accomplish that? And it's basically a tool that you're going to learn for looking at policies in a practical way and kind of making a judgment. Maybe there's 3 alternatives that you're considering, right? And this will give you the chance. I mean, when I worked on Capitol Hill, I had never taken this policy analysis class. So I was like just a veterinarian on Capitol Hill, like trying to come up with what seemed like the best answer. And there's an intuitive way to do it, but we're going to give you an actual tool to do that. On the quantitative side, we really stress, like for data modeling, we can't do this in a vacuum. This is not data science in a vacuum. There's a whole class that's being taught right now by Dr. Carlin, who's a wonderful data modeler, on like these models are only as good as the numbers that are put in. So outputs are only as good as inputs. Well, how do you evaluate if a paper that you're reading had good inputs or not? There was so much use of models during the COVID, early days of the COVID pandemic, but most people, certainly the public, policymakers, public health officials, nobody had experience like to actually evaluate whether they should be using these to make decisions. So we can help you learn to critically evaluate the literature so that you can make evidence-based policies, or just learn to make better models if that's what you're trying to do.
I have a question.
Sure.
Why would you recommend this degree versus like another school's master's in science in like infectious disease or something like that?
Great question. So I think GLID is really special. As you know, I did not invent GLID, so I'm not, I don't come from that perspective, like this is the only program out there. You guys have a lot of choices. I think it's actually overwhelming, to be honest, how many choices you have. You have a lot more now than I did. Many students will be thinking, do I want an MPH or an MS? If that's your specific question, let me know, because that's a very specific calculus.
Yeah, that's one I want to know as well, like wavering between an MPH or an MS. So yeah. Mm-hmm.
What I would like, the place I would like to get to with GLID is that we never have a student applying both to the GLID MS and to some other school's MPH. I'd much rather see you apply to the GLID MS and another school's MS, because the MS MPH is sort of a false comparison. An MPH is really a practitioner's degree. It's a professional degree, not unlike medical school or veterinary school, right? It's teaching you almost like how to go out in the world as a technician and, be a public health professional, right? A lot of jobs actually require an MPH specifically. If you, for example, want to go spend your career in a local or state or, depending what country you're from, like a subnational health department, they may want to see an MPH on your resume, or they will not consider you for the job. That's just the reality. So this is important research for you guys to be doing, which is like, what are some of the jobs I think I might want one day? And what degree do they require? I think over time, we'll see some of those requirements for MPHs changing, because there are more and more other types of master's degrees being offered. The MS is really for people who want to dig into the science, right? The Master's of Science is about the science. How does infection work? Like, how does it actually affect the human body? What is the microbiology of viruses and bacteria and parasites? So that even if I don't want to be a bench scientist, maybe I want to work at USAID on neglected tropical diseases, I better know something about parasitology, right? Like I have to be able to explain the science of that. I need to be able to explain how parasites become resistant to the drugs that are designed to prevent or treat them. We dig into that more than you would get in an MPH program. In an MPH, you can definitely focus on epidemiology, right? So if, let's say, epidemiology is your thing, you have choices. Like you can do an MS in epidemiology at a lot of schools, including Georgetown, by the way. You can do an MPH with a focus in epidemiology. The thing about GLID is that you won't get as many classes in epidemiology, but the ones you do get will sort of emphasize infectious disease. Right now, the epi and biostats courses that our students take are part of the epidemiology department. So they're really like foundational. We're creating new classes in epi and biostats that are really focused on infectious disease. So I don't know if that, answers your question. I think, a master's of science is really designed for someone who frankly might end up in some of the same jobs as someone with an MPH. If I come out of school in 2 years with an MPH from Hopkins or an MS in GLID from Georgetown, I might actually end up applying for the same job that I would have, regardless of which of the 2 degrees I got. And some employers won't care. They're just going to want to see a great master's degree. But you should be thinking about the skill sets that you're interested in. In MPH, you might learn a whole lot about the creation of line lists. This is a tool that public health professionals use. You might learn a lot about contact tracing and how that works. Here, we're going to be spending time talking about the more interdisciplinary examples of how infectious disease have happened in the past, modeling how they might happen in the future, coming up with policy solutions. So, and I should add that, even the data modeling students, you're going to get some policy and vice versa. So you have to be interested in multiple disciplines for this MS versus, in MPH, for example, where you can just focus on being that public health practitioner. Or in MS in, say, microbiology or epidemiology or immunology, where like you're taking 30 or 40 or 50 credits in that discipline. If you want to be that level of expert, then you should take that MS route. If you want to be that sort of interdisciplinary person in your office who can sort of walk that line between different disciplines, then this is the right degree for you. Is that helpful?
Yes, that was helpful. I just have 1 or 2 more questions.
Sure.
Do you accept international students, and do you provide the same like merit-based awards to international students as domestic students?
We do accept international students. We encourage international students. We want to make our program sort of as diverse as possible in every way in terms of demographics, where people are coming from. We provide the same level of merit aid. It usually amounts to about like 20% of the tuition we can cover through merit aid. Some students may be able to get more. I get international students who are looking for a full fellowship, and I get domestic students looking for that too. And unfortunately, I don't have the funds for that right now, but we are applying for grants so that for the next few years, we actually will have hopefully grants to support much larger scholarships for students, both domestic and international. Did you have another question, Alex?
My next question would be like, is there like graduate assistantship opportunities for people in the MS program?
Mm-hmm. Yep. So any of our master's students are eligible to work on campus as a research assistant. And there's a very lively like global health community at Georgetown. The Global Health Initiative has opportunities. The Center for Global Health Science and Security. There's Center for Global Health Practice and Impact. So these are all places that potentially can support research assistants. And those jobs usually pay about $20 an hour. So depending on how much you work, it could be like a nice way to support your income. We certainly encourage students who feel that they can handle an internship to do so. And we always want your internship to be a paid internship. Please don't take a free internship. If you really want to take a free internship, come talk to us and we'll see if we can do it like for credit so that you're not just doing it for the bullet on your CV. But but yeah, so we can't guarantee, like, we're not responsible for finding you on-campus employment, right? So that's something you need to reach out for, but we're always happy to support with tools, resources, letters of recommendation, etc. Any other questions? Corey, nice to meet you, by the way.
Yeah, nice to meet you too. So just to piggyback off of what you just said about internships, I know you don't have too much information about postgraduate employment here, but could you give us a little bit more information about maybe what some of your students have been doing while they're getting their degree?
Mm-hmm. Yeah, so we've had students, I mean, it's really diverse. One of the things that you'll find, I think, with GLID, because we're an interdisciplinary program, when we have these like divergent concentrations, is that students choose to do really different things. So one student has been a research assistant in Shweta Bonsal's lab, we call it lab bench, but it's really a computer, right? She's doing computer modeling as a job, like supporting the work of that lab. Another student has been working in a vet clinic, right, part-time, because she's applying to veterinary school. We have other students who are more advanced in their careers. We actually have a physician in the program this year, and she's doing like WHO consulting, right, in her part-time. I haven't had any students yet do like an off-campus internship on Capitol Hill or at the NIH or HHS. I would love to see that happen, because I think that's totally within the realm of possibility for the students in this program. But those are just a few examples that I can think of. Another student is doing an internship this semester for a nonprofit that's, I don't know the name of it, but it's like a health equity nonprofit. And I think it's a virtual internship. So it's online, probably because of the pandemic. But so yeah, lots of options there. It really just depends what you're looking for.
Thank you.
Sure. Omar, any questions from you? I know we've talked, this is really the second time you've heard this. Sorry about that.
I guess I have a bit more of an administrative question. In terms of decisions, I know like the priority is January 1st and the last deadline's April 1st. Is there like a decision date sometime during the summer where we'd hear back?
Oh, you'd hear back if you apply by January 15th. It is my goal to get you an answer within 8 weeks, if not before. So same, you know, if you apply, I think what will happen is we'll get a tranche of applications by January 15th. We'll look at those all together and aim to get decisions out within 8 weeks. I would love for it to be 4 or 5 if we can do it. And then anything that comes in thereafter, we probably won't wait till April 1st to do another bucket. I'll try to do them as they come in. But if you can apply by January 15th and say, well, it'll be March when we get you a decision, that should give you time to think about your options. I think a lot of schools have like a mid-April like deadline for letting them know whether you plan to matriculate. So we want to be mindful of that and give you enough time to weigh all of your options, and also time, like if you're thinking about taking summer courses, prereqs, anything like that, to register for those. Those, by the way, can be done. They don't have to be at your undergrad institution. They can be done online. I had a student do University of Phoenix last summer. You can do your local community college. Just has to be an accredited program, and you should be running those classes past me before you take them.
Dr. Carlin, I had a quick question. I'm not sure if it's going to be applicable to everyone, and so if it's not, I can also email you individually. But for that 5-year program, are the admission requirements the same as if you were applying as a senior?
You're Georgetown undergrad, right?
Yeah, I'm a biology of global health major.
You're BGH. And are you a senior?
I'm a junior.
You're a junior. Okay. So the requirements are the same, but you cannot apply to the accelerated program once you are a senior. You have to apply your junior year. And so you're going to graduate in May of 2023?
Yes.
Okay, so now is the perfect time to be applying, because what that does is we get you a decision in the spring. If you can apply by December, we can get you an early decision, right? And then you can take courses in your spring, potentially, that would apply to the program. But if not, you'd certainly take courses your senior year, and then we can double count or transfer courses off your transcript to apply to the accelerated program. So don't wait until senior. If you wait till senior year, then you just have to apply with everybody else, and the double counting doesn't happen.
Okay, amazing. That's super helpful. Thank you.
Sure. All right, well, we're almost at time here. Lots of great questions. I hope this was informative. My email inbox is always open. It's always really full. So just give me like a few days to get back to you, but I always will. There's also a cell phone number on there. Feel free to call me if you want. And otherwise, keep in touch. Lots of luck applying to Georgetown and wherever else you're applying. I'm sure you're all going to do great. And I hope maybe to meet you at Georgetown next fall.
Thank you so much, Dr. Carlin. Take care.
Bye, Caleb. Bye, everybody.
Thank you.
Thank you.